Good afternoon. My name is Lori Reeds, and I'm a registered nurse and clinical care leader here at Sanford Webster Medical Center. I would like to introduce you to a program called Chronic Care Management, or CCM, that we've been doing for about the last year here at our facility. Chronic Care Management, or CCM, is a Medicare-based program for patients that have 2 or more chronic health conditions. And just to give you a little bit of background on the program and how we came to implement chronic care management, we had a grant program that ended in May of 2020, and that program was community-based and it was very well received by our community. So what we wanted to do was find a program and have it be a sustainable program that would bridge the gap for our patients between their healthcare provider visits and the patient. Sanford Webster was given an opportunity to be a pilot program for chronic care management and hopefully have this as a feasible program that would go throughout the footprints of the Sanford health system. Medicare patients, again, that have 2 or more chronic health conditions that put them at risk for significant health decline, acute exacerbation, or even death, can be offered chronic care management. And this goal of the program is to better manage their health conditions and to establish goals and a care plan for them. And some examples of the health conditions could be Alzheimer's disease, dementia, congestive heart failure, atrial fibrillation, depression. Those are just a few, even arthritis. If it is going to put the patient at risk for significant decline, acute exacerbation, or even death, and they have 2 or more qualifying conditions, they could be enrolled on chronic care management. So the objective of our program, or the purpose of the project, was to provide better care management and to help avoid our patients having health events such as going in and out of the emergency room, having falls, or even just an overall decline in their health or chronic health condition. Our goal is to have 90% of compliance of patients that have hypertension to have their blood pressure below 140/90, and those that have diabetes to have their hemoglobin A1C below 9%. And some of the steps that we've taken to implement these goals is, first of all, we had to educate ourselves on the program before we even implemented it. That meant reaching out to other healthcare facilities and networking with other healthcare facilities that currently had chronic care management, as well as making ourselves aware of the Medicare requirements for chronic care management. We also had to develop a coordinated internal team and a project charter. Members of our team included our administrative team here at our facility. It also included some clinical staff, the clinical manager and the RN health coach, as well as a representative from the finance department and from the CI ops team. The Epic build had to be developed from square one, so this was something that was new for us. And that build had to include our documentation, our care planning, as well as including how we were going to charge for the program. We also developed a consent form and an education form for our patients, so that was information that they could look at and review before they even would go on the program, just to give them a little bit more education on the program so that they were fully aware of what they were enrolling in. And these consent forms and education form had to be developed, and it was approved by marketing, so that is something that we use now at our facility. And then June of 2020 was when we wanted to begin offering chronic care management to our patients. So that's when we first started enrolling patients. We started gradually. We're now at about 28 patients that we have currently enrolled on the program. Some of the actions taken to enroll a patient was, first, the patient has to be screened. So they have to be screened to see if they're even going to qualify for the program, and then a consent is offered to those. with a qualifying diagnosis. And then patients can receive a comprehensive care plan and will, receive a comprehensive care plan that will establish a treatment plan or a care plan moving forward for them and establish goals for them. Chronic care management also gives them the opportunity they need to help manage their chronic health conditions at home in between provider visits. It makes a patient more conscious of their overall health, their medications, maybe even managing treatments, managing fall risks, and other self-management goals. Clinical staff or RNs can make referrals for other resources that the patient might need at home, such as Meals on Wheels, making a referral to the doctor for therapy, maybe even Life Alert, just maybe reaching out to some referrals and resources that will make them be more safe at home. And then finally, our practitioners can bill for chronic care management if 20 minutes of clinical staff time is reached in a calendar month. Chronic care management can be billed for. And so just to go back on our metrics area, currently, as I said before, we have about 28 patients currently enrolled. That is subject to change just for patients that maybe they will go into the nursing home. Maybe they decide that they don't want the program. So they can decide at any time if they do not want the program. We can take them off of chronic care management. But again, our current enrollment is 28, and we bill for code G0511, which is a rural health code. Medicare is billed $107, and after Medicare Part B and the copay, our reimbursement is a little over $66. So right now, with the 28 patients enrolled, just to give you an example, on average, our reimbursement is about $2,500 a month. And then also one of the metrics, besides the hemoglobin A1C, is the hypertension. And I'll just give you an example of a patient that we currently have enrolled. And we enrolled this patient. She was an 86-year-old female patient that lives at home alone. And she had some chronic health conditions, including hypertension, hyperlipidemia, osteoarthritis, and also active cancer diagnosis. So she was enrolled a little over a year ago with a very high blood pressure. After enrolling her in our program, we were able to establish a care plan and some goals to move forward with. We were able to educate her on her diet, her medications, assist her in enrolling in a wellness program. And since she's been on our program, her blood pressure has come down significantly, and she now is within normal range and overall is just feeling better. So that would be a success story, I guess I would say, on our end. We also reached out to have a review or an analysis done of our program just to make sure that we were doing things correctly and according to Medicare requirements. So we did reach out to compliance for a compliance audit, and they actually had to do some research to develop a tool for an audit to review our charts. An audit was completed, and some of the findings on that review or audit included that we needed to make our care plans more comprehensive, as well as increasing our provider involvement, our medical provider involvement. So we made some plans for correction with that and implemented that, and we are currently working on those plans of correction now. We had to go back and work on an Epic build to upgrade the care plans in our one chart system. So we had to reach out to CI Ops for that, and they had to work on that build and put that upgrade into our system. Also, we had to make some changes to our chronic care management order. and that included just having the medical care provider just be more involved in the program. And so our plans, just to move forward with our next steps are just to continue to monitor that compliance and plan another audit in about 6 months. And we continue to encourage chronic care management referrals in our community and in our practices here in Webster, and just provide education to our community about the program. So in conclusion, the benefits of chronic care management, or the gems of offering this program in your practice, would include improved care for patients, improved patient satisfaction, as well as increased payment for the practice that is providing that service. And then lastly, the benefits or the gems of offering chronic care management services for your patients include just having a clinical staff member that is able to reach out to that patient and help them oversee their care. Also, the team member can help the patient plan for better health and stay on track with their treatments, and their medications and their appointments and any referrals that they might need. And they can do that just by making phone calls, or as we call them, check-ins with that patient. And then lastly, by encouraging patients to use chronic care management services, it may offer them the support they need to better provide that they may need between their provider visits to manage their chronic health conditions and to stay at home safely. Thank you.